MPPs will return to Queen's Park tomorrow after a lengthy break. The Ford government has plenty on its plate as the legislature resumes. Bill 124 will be repealed following a ruling by Ontario's top court that it was unconstitutional. Also, the province plans to reverse its decision to dissolve Peel Region, which was met with fierce resistance from Brampton officials. And the PC party's planned Get It Done omnibus bill would prevent any future government from enacting tolls of highways, streamline approvals for major infrastructure projects, and make license plate renewals automatic. A new report finds that the province needs thousands of additional personal service workers by 2030 as the population ages. And CTV's Tony Grace joins us live with more on that study. Tony, good morning. So first off, tell us about the findings in this survey.
Yeah, good morning, Bakari. This is really putting a lens on an issue that has been a source of concern in the healthcare sector for some time, and that is, of course, the broader issue of caring for Ontario's aging population, a population that's expected to keep growing, by the way, over the next 6 years at a faster rate than it's grown over the past 20-year average. So consider this study commissioned by Home Care Ontario, some academics at McMaster University who specialize in the areas of healthcare and health staffing involved in looking into these numbers, and they predict that 6,800 personal support workers will be needed just to keep current service levels. And they also note that the 65-plus age group in particular is expected to grow by 650,000 people over the next 5 to 6 years. The 75-plus category, Bakari, expected to grow by 350,000. And the study really calling for an immediate ramp-up of training for workers in this sector, but it's also noting that it's not just personal support workers, PSWs. There could be a similar need for nurses, therapists, and other healthcare professionals in this sector, Bakari, as that population continues to grow at a faster rate.
Okay, so Tony, why is it highlighting those concerns about a ripple effect on hospitals?
Well, because the overcrowding that we're seeing in ERs, particularly at small town ERs across southern Ontario, is linked in many ways to the aging population. And if you have more seniors who are not able to get that care at home and who are turning up at hospitals, well, that's adding to the situation, the pressure that's being faced in emergency departments. Bakari, there were more than 200 unplanned ER closures across southern Ontario over the last couple of years. We've been reporting on them extensively, of course, on CP24 and on CTV. And this study is saying that that is being exacerbated. The staffing shortages already in place at hospitals are being exacerbated by more people coming into the ER. And if you have a population with greater healthcare needs turning up at an ER more often and ERs closing more often, well, that's certainly a perfect storm for a problem for the next 5 to 6 years. So a lot for the provincial government to consider in this report as it continues to look at transforming healthcare, Bakari.
Again, 6,800 PSWs needed by 2030. CTV's Tony Grace. Tony, thank you for this update.
You bet. Have a good day.
You too.